Joe 200, how you doing? It's June 4th, and we're going to continue on with our short stint in biology. I know you guys are not biology majors, at least some of you, although on the discussion, some of you were impressing me with being biology majors. I noted that a couple of people actually were looking to be going to medical school, which is absolutely awesome. And understanding your client, okay? Because if you go into medicine, if you go into healthcare, healthcare services, you have to realize that 95% of your clients are people that are old, okay? Because chronic diseases of aging are the ones that take up all your time when you're a doctor. So, and guess what? All the rest of you, okay, there are serious implications in terms of your personal life, in terms of your parents and your grandparents' personal life. You know, having to be a caregiver for somebody that suffers from a disease. Remember last week I discussed what was going on in our family, okay, when I had total knee replacement done in March, and at the same time, my poor wife Julia was suffering from a pretty significant battle with her leukemia, which is a cancer of her immune system. Yes, it takes a lot of your personal time, which then eats away at your financial well-being. It also eats away at the social aspects of who you are because you only have so much time to split. Okay. Alrighty. So as we continue on in our adventure, what I'm going to do is I'm going to show you. This is what it looks like when I'm doing it. It's going to take a second here, and what I've done now is I've changed the look of the course, so it's what you guys are looking at. Now, Julia emailed you again today. You do have something due, and it's important you guys understand. Okay, in the business world, you have what's called a deliverable. Okay, all right, that means it's due now. And if you are working and you do not meet your deadline or due date for your deliverable, then you suffer consequences. Okay. Alrighty, and so in this class, you suffer consequences in terms of having a penalty associated with being late, okay? So you really need to keep your eye on what's going on through here, okay? Some people have emails, hey, where did the discussions go, okay? The discussions open and close, open and close, open and close, okay? You can't go back in retroactively and have a discussion because there's really not much of a discussion now, is it, if everybody else has already moved on? Okay, we see today a very short paper looking at population dynamics on world population, fertility, and going to that amazing website that I talked to you about last time, okay? Again, one of the easiest ways to create a graph, if you have trouble in terms of, I'm looking for you guys to be creative, but if you're having trouble in terms of graph creation, then all you need to do is just do a print screen, throw it into PowerPoint. You can crop it however, whatever size you want, okay? This is true down the line as well in terms of any figures you're doing. And then you can just take that image and paste it right into your Word doc. You can you can make a JPEG if you want, a PNG, whatever it is you want to do, okay? That's a real simple way of doing things. Alrighty, so I want you guys to go back and look at your discussion. All of us, Tim, Julia, and I, we get in there randomly and we will be posting. We're reading everything, which is awesome. You guys are blowing my mind. I was reading one about the, I think it was Alexander was talking about the effect of cross-linking and how it chokes off the proteasome. And I was like, dude, proteasome. Man, this guy knows more than I do, which is true, okay? You guys are very smart people. We are not all knowing. Oftentimes you guys will know more than we do on certain subjects, okay? So yeah, this proteasome is a garbage disposal. It's found in every cell, and with aging, it doesn't work so well, and so the garbage backs up. And I mentioned that in Alexander's post, okay? I was looking at Emily's post, okay? Both the reproduction and the theories in aging post, okay? The reproduction is a funny issue, okay? It's a very personal issue. Certainly I think everybody wants to be able to do it naturally, but sometimes things get in the way, Sometimes financially, you're going to have to work, okay? And you're not going to be able to afford a kid. Sometimes no, more power to you if you can't, okay? But if you can't, and you have to work, and then, forgo those prime reproductive years, you may be looking into some of the things that we talked about. And we just put it out there so that you are educated. Yes, it is costly. No, it isn't covered by insurance. And I made a comment in Emily's post. Isn't it interesting that erectile dysfunction drugs are covered by insurance, but fertility for women is not? Go figure, okay, in terms of who's making the decisions in terms of insurance companies. Okay, so in terms of the reading assignment, okay, this was the 28th. Here we are, June 4th, okay? So we're moving on to our last little stint in the biology, okay? And we're looking at diabetes and heart disease, okay? And then here we'll also look at some biology in Alzheimer's. We link these three together, okay? This, and this right here, okay? Because the metabolic syndrome of obesity, it's all interrelated, okay? And when you guys do your second critical thinking assignment down here due by June 18th in a couple of weeks, we're going to ask you to address that issue of how things are interrelated. One thing that's important to consider is when we look at the epidemic of Alzheimer's disease, and I think you guys got a feel from this course how this thing is just going to explode because we're allowing people to survive, and we have this age wave, okay? 80% of cases, Alzheimer's disease cases, have diabetes, okay? So much of it is preventable, okay? And that's what we're getting into here in terms of this assignment. All right, we kind of try to break it up. So the discussion oftentimes does not complement, but it gives you new information. And that's where we did reproduction separately, okay? We're gonna get down here, health, aging, death, and dying, because so many of the things we talk about here, cancer, diabetes, heart disease, the #1 cause of death, and morbidity, which is a chronic illness, okay, in our country, and then the growing epidemic of Alzheimer's, okay? So these are all big death and dying issues, so we kind of try to keep it all together. Then we get into the caregiving over here. I promise you, my business majors, we are going to kick ass when we get down here in terms of these economics, okay? So we're going to, down here, we're going to talk about some of the world economic issues, okay? Real short paper that is really amazing. And then we're going to get into something that you all need to understand so you can advise your parents, grandparents, and prepare for your future aging. And that's planning with respect to Social Security, when you're going to draw from it. 401ks, okay, this is a defined contribution, okay, individual retirement accounts, and Roth IRAs. I'll also talk about pensions, but we're not going to get into that in terms of the reading. All right, awesome. Now, how do we go about doing all this stuff? So we're going to go into the course readings. Again, these are open the entire semester for you, but it's better to get up on it right now. I'm going to click on diabetes. And you can go to the website, but see, websites change, unfortunately. So that's why we have these PDF files. So what we've done is we've made a PDF file of each of these elements. So you can go in here, okay, and you click on it, okay. And, sorry, there we go. And so what I want you to do is go through each one of these. Ask yourself, what is diabetes, okay? What are the different types? You should understand that this is juvenile diabetes, type 1, okay? It's an autoimmune disease, which means what happens is the immune system actually attacks the person's endocrine pancreas, okay? And that's the pancreas that releases the hormone insulin, okay? And then there's type 2 diabetes, okay? This has a genetic vulnerability. So if you have a history of this in your family, you have to be very, very careful. It's associated a lot with diet and exercise and stress. Lifestyle factors contribute to it. This results in what's called an insulin resistance. I'm sorry, I'm just trying to keep myself from sneezing right now. Anyways, okay. And then we have the diabetes associated with pregnancies, okay, because of changes in hormones. So you're going to learn all about this, okay? I'll go back in your browser and you just sift through all these and you answer the quiz that way. Now, I put it out there that we also have, as you see right here, PDF files of each segment, okay? And so here it is again, but we just created PDF files, okay? By just doing PDF print files, okay? All right, so you have both for your use. Then you're going to study these two videos, okay? And a lot of these are the complications, okay? So this is what causes diabetes. This is your, we heard about in the theory of aging, we talked about cross-linking, okay? We talked about glucose and glycation, okay? And this is what the A1C test is all about, okay? It gives us a view of your kind of chronic level of glucose because you get this glycation of hemoglobin and it lasts for a really long time. So it's the best readout as to whether or not you are a diabetic. We can also look at an acute test, okay, which is your fasting levels of sugar, and then we can also look at glucose challenge tests, okay, where we'll give you a set amount of glucose, okay, and we see how high it gets and how long it stays, okay. So, but those are looking at acute. The cool thing about A1C is this is a true measure of your chronic risk. Alrighty. I talked about insulin resistance, that's in here, type 2 diabetes, and then it says right here in the video, okay, complications, right? And so we're going to go through all these complications. This is and I'm going to give you a quick aside on this. Every one of these complications is because of the glycation of your blood vessels, okay, inflammation that happens with obesity, okay, and in the end, your pipes, okay, your arteries, okay, your blood vessels get destroyed and you develop this atherosclerosis, okay? They get candy coated, kind of like our Christmas hams, okay? But they also get fatty plaques. So what happens is blood delivery and immune system delivery gets compromised in every single system in our body. So that's where you get this neuropathy, okay? Because of poor blood flow to your legs, okay? We see over here stroke and heart disease. We see here kidney disease, foot problems, okay? And then this goes into the other things, other aspects of diabetes we talked about, gestational diabetes and pregnancy. All right. Then from those, you can do your quiz. That's what that's all about, okay? We go on to this to the next course reading, okay? And we see that it's linked to this, and this is diabetic heart disease, just I was talking about. So the blood vessels that deliver the blood to the heart, so the heart pumps and delivers blood right back to the coronary arteries. It loops right back to the heart because the heart's always working, boom, 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 like that, okay? So it has one of the highest demands for glucose and amino acids from the protein you eat, fats, everything. It's always crying out for oxygen, so you need to pump the blood through there. But what happens with diabetes is the arteries, the coronary arteries that go back to the heart, they get atherosclerotic, and next thing you know, you start having chunks of heart muscle dying off. My dad died from this, okay? So he died of a condition called congestive heart failure, and it's basically slowly but surely the heart dies off. Or you can have an acute event where the blood vessel gets blocked and you have what's called a coronary or a heart attack. All right, so this is why this is very, very important. Same deal. You can go to the website, okay? Sometimes the website will change, okay? And here we are, and see it's slow in getting there, so I'm just gonna go back over here, okay? Maybe it's my computer, I don't know. Or you can go to these individual chapters, okay? So I'm back, there it is. So by clicking on this, it takes you to each element, and then each of these elements are shown right here as well, okay? So it's just a backup. So this is the process of atherosclerosis. Boom, you do the quiz, okay? Now do understand that we have probably 20 questions, okay, from a pool, and randomly Blackboard will insert 5 questions in each quiz. So no two of you are going to get the same quiz, okay? And then when it comes back to the midterm, we take 4 or 5 questions from each segment, and again, from that 20 question pool, randomly that gets inserted back into the midterm. So you may see the very same questions, or you might not. Okay, next, the discussion, okay? Alrighty, So, alrighty. So, when you look at the discussions, okay, so these are the two that are on right here, okay, do understand that we're in there reading, we're in there commenting, okay. So we look at the theories of aging right here, boom, okay. And if we look at the individual contributions, you can see that sometimes we have been posting in there, okay. So if I look at um, Cameron, there it is. I said, it's posted on your other ones. I go back, okay, and because Cameron did too, and there it is. So, okay, well, did the same one, but anyways, okay. But yeah, I think you get the idea, okay, alrighty. One thing you can do to see how things are going is do tree view, okay, alrighty, and then we're going to expand all, okay, and so hit tree view, hit expand all, and now you can see all the different places. And like I said, randomly, you'll see either Julia or myself kind of jumping in there and jumping in on the discussion, okay? And we still got a ways to go, but you see us in there. So anyways, so that's kind of how it works. There I am, all right? See, I posted right in there. Okay, I posted right in there, all right? So Cameron's, Madison's, okay? You just never know how it's gonna happen. All righty, so try and get things in on time, all right? Think about who you're gonna interview for your interview paper. Go back and look how to get an A. It's pretty simple stuff, guys. All righty, so that's it today for today's lecture. It kind of explains the logic behind what's going on. We keep, you know, reminding all of you of the scheduling because I think that's part of the hardest thing. Lots of people get A's in this class, guys. So you just do the work, you're going to do really well. All right? All right. All right. You guys take care now.